Chapter 17, Fat Soluble Vitamins, page number 318. Those who are joining late, please help them out with the page numbers. So we'll start today's session. Page number 318 in the Nutrition Science textbook. So vitamin D, okay, um, it's a common myth that sunlight gives you vitamin D. Sunlight doesn't give you vitamin D. Okay, sunlight just activates vitamin D derivatives which you already have in your body. Okay, so vitamin D, it exists in two forms. Vitamin D3 cholecalciferol, that is from animal origin, and vitamin D2 ergocalciferol. Ergocalciferol is from plant origin. Okay, these are the precursors of vitamin D. The main vitamin D. Vitamin D is the only vitamin that acts like a hormone in your body. Okay, that also especially that comes from the form of vitamin D, which gets activated, and it comes from animal source, calcitriol. Okay, cholecalciferol. So these are the two main structures of vitamin D2 and vitamin D3. Okay. Vitamin D3 is from animal source, vitamin D2 is from plant-based source. And vitamin D3, that is from animal source, is 3 times more potent than the plant source one. Okay. And it is able to improve the vitamin D concentration in your blood serum for a very longer period of time. That's the reason why plant sources of vitamin D it doesn't work in your body. Okay, plant sources are a very bad source of vitamin D. So how does vitamin D synthesis happen? Okay, how does vitamin D synthesis happen or take place in your body? In humans, first the sunlight that hits on your skin, okay, ultraviolet rays of the sun that hits on your skin, and there is also wavelength in sunlight, okay, between 290 to 315 nanometer. If that is the wavelength, okay, of the sunlight, it initiates the conversion of vitamin D3, that you already have under your skin. Okay, vitamin D3 in the form of 7 dehydrocholesterol, that every one of us, we have this under our skin. And when the specific wavelength of sunlight hits your skin, okay, this 7 dehydrocholesterol, that is a precursor of vitamin D, it activates it will initiate the conversion of this dehydrocholesterol into cholecalciferol, vitamin active form of vitamin D3. This 7 dehydrocholesterol is inactive form, it stays inactive, it has to be activated. Okay, and photoconversion has to take place. Photoconversion means that the conversion that takes place in the presence of sunlight. Okay, so when this photoconversion takes place, the inactive form of vitamin D converts into active form of vitamin D3. The same vitamin D3 that you get from animal sources as well. Human beings are also animals. Okay. So if this form of vitamin D3 is available in animals, it will also be available in human body. Okay. So vitamin D3 is activated and it goes into your liver through your to your blood circulation. Free vitamin D3 uh, is available in your blood serum levels. It goes into your liver where it is stored. Vitamin D is stored there. Okay. Vitamin D3 produced in humans is stored there. In the active form, it is stored in the liver. So, and whenever it is required, liver will secrete it. Okay. And on top of that, you already have vitamin D3 that your body can synthesize and produce, that is already there in the liver. On top of that, from your diet, okay, when you take diet, when you eat food, okay, if you are eating animal origin food like milk, Even dairy products have vitamin D3. Okay, dairy products come fortified with vitamin D. Okay, and if you are a non-vegetarian, all the non-vegetarian sources of food, they also contain vitamin D3. Okay, so from your dietary intake also you're getting vitamin D3, direct active form of vitamin D3 you're getting. Conversion is no longer required. The one that you have already in your body, conversion is required, but direct source of vitamin D3 you get from the food. Okay, skipping the conversion. And vitamin D2, plant sources of vitamin D2 in the form of supplements. Okay, plant sources have vitamin D3, but your body will not absorb it. So plants are not a source of vitamin D for humans. Okay, plant ergocalciferol under laboratory, it can be synthesized. Okay, it can be formed into supplementation, and then it can be sold over the counter. Okay, so vitamin D2, ergocalciferol in form of supplements only, because some enzymes are also added, some absorption minerals are also added, which enhances the absorption of vitamin D2. Okay, and that's how you get vitamin D2 from supplements. These two vitamin supplements you get through your diet. Okay, that also reaches through the intestine. It will reach the intestine. From the intestine, it will again go back and be stored in the liver, and whenever it is required. Now vitamin D3, D2, D3 and D3 from animal sources are also in the liver where it is stored. Okay, now in the liver, again, when liver has to send vitamin D into the bloodstream, okay, it will not send cholecalciferol into the bloodstream. Liver enzymes will cause some changes in the stored vitamin D, okay, and it changes into 25 hydroxy vitamin D3. Okay, you are adding the hydroxy ion. The liver adds hydroxy ion. Okay, hydroxy ion is added, oxygen and hydrogen ion is added in the on the 25th chain. If you know, everyone knows that these are organic, okay, in nature. Organic means they have carbon composition. So if you see the carbon structure of vitamin D3, it has almost 25 carbon structures. Okay, on the 25th carbon atom, oxygen and a hydrogen atom has been added. Okay, so that's why 25 hydroxy vitamin D3. Okay, additional hydrogen and oxygen atom will be added on the 25th carbon atom of vitamin D3. So it becomes 25 dihydroxy vitamin D3. It goes into the kidney. Kidney also adds one more hydroxy atom. Okay, liver have already given a hydroxy atom, but now it goes to the kidney. Kidney will give one more hydroxy atom. Okay, but on which carbon atom? The first one, the first carbon atom that vitamin D3 has. Okay, so 125, it already has the hydroxy atom on 25, and now kidney has given it a new hydroxy atom on the first carbon. So 125 dihydroxy vitamin D. Okay, earlier it was only hydroxy, but now it has two hydroxyl atoms. Okay, so dihydroxy vitamin D3. Okay, and this 125 dihydroxy vitamin D3, this is what acts as a hormone in human body. Is it clear to all? The vitamin D synthesis. How from a inactive state, how from an inactive state of dehydrocholesterol, 7 dehydrocholesterol, how vitamin D precursor became into a hormone. Is it clear to all? Liver and kidneys play a major part. Liver and kidney both will give, just take an example, they gift the vitamin D3 to hydroxy atoms, okay, on the 25th carbon atom and the first carbon atom. So now you get 125 dihydroxy vitamin D3, and that acts like a hormone. Okay, how it maintains your calcium balance in the body. We will learn the functions later. Okay, coming to the functions of vitamin D. helps to form strong bones and teeth. Why? Because it maintains calcium within your body. Vitamin D also enhances the absorption of calcium. Okay, it helps your muscles to contract, even your heart muscle and each and every muscle, skeletal muscle that you have in your body. Okay, for the contraction of these muscles, vitamin D is required. Just like calcium is also required for contraction of muscles. Okay, it also helps your nervous system to carry messages between the brain and body. Okay, so helps in the health of central nervous system. It also supports your immune system. Okay, so these are the main functions of the of 125 dihydroxy vitamin D. So this is the same explanation. Okay, your skin has 7-dehydrocholesterol, which activates in the presence of sunlight into free vitamin D3. Free vitamin D3 cannot be used by the body. It can only be, it has to go into your liver to get activated. Okay. So it will go into your liver. Liver will give, liver will gift hydroxyl atom to the carbon chain on the 25th carbon chain. Kidney will also gift one more hydroxyl atom on the first carbon chain. So 125 dihydroxy cholesterol. Okay, and then this functions as maintains the bone health, helps in the formation of immune cells. It also helps in the sustenance of healthy sustenance of liver cells. Okay, and whatever is inactive, the byproduct of this conversions, those will be excreted out of your body. Okay, and from diet, mainly from fish, all your dairy products, and even fortified food, whichever food is fortified with vitamin D or supplementation of vitamin D2, these are also good sources of vitamin D. Okay, there are many other functions of vitamin D as well. The metabolites of vitamin D, for your muscle strength, for your bone health, and also the health of your hair follicles. Vitamin D deficiency can also cause severe hair loss. Okay, if the serum vitamin D levels are too low, it can cause severe hair loss as well. It also helps in the health of your DNA, and also to create some specific protein at DNA level. Vitamin D is required for your immune system, development of female reproductive system, for good skin, development of brain cells, breast tissue, endocrine cells in the stomach. Vitamin D is required. Some studies have classified vitamin D as an anti-cancer agent. Okay, it can stop carcinogenesis. Studies have not proven it, but it could have anti-carcinogenic work as well. To prevent autoimmune disease, diabetes, vitamin D is required. It can also prevent inflammation in the body. So these are some of the main functions of vitamin D. Absorption, the major absorption of vitamin D takes place in the jejunum of your intestine. Okay, duodenum, then you have jejunum, then you have ileum. Jejunum is the middle part of your small intestine. So major absorption of vitamin D takes place in the jejunum part of your intestine with the presence of bile salts and also chylomicron that is present in your intestine. Okay, chylomicrons I have explained earlier. It's kind of a fat phospholipid and a fat globule that helps transporting fat soluble vitamins from the intestine into the bloodstream. So coming to the deficiency of vitamin D, rickets in children and osteomalacia in adults. Okay, vitamin C deficiency will lead to rickets in children, in growing children, And if it's an adults, after being an adult, you got vitamin D deficiency, it leads to osteomalacia, softening of bones. Osteomalacia means your bones become soft because of the loss of calcium and other minerals from the bones. Okay, this is how rickets look like, bow-legged. Okay, we call it as bow leg. You can see here how a normal leg should appear, and how a child who is suffering from rickets, how their legs develop. Okay, they will not be able to join their knees. Okay, they will be able to easily able to join their ankles. They will be easily able to join, but when they stand upright and they try to bring their legs closer, whatever they do, the knees will not touch each other. That's rickets. Okay, and rickets can happen in any shape or form. Okay, you can see here another case of rickets in which both the legs are bent in the same direction. Okay, but you can see this severe bending of the bones is seen. Surgical treatment will be required here. Okay, nutritional supplementation is required, surgical treatment is required. Sometimes prosthetics may be required after surgery. Okay, to correct this. And osteomalacia, demineralization of important minerals from the bones, will make the bones very soft and prone to easy fractures. Okay, a small push or a small trip on the stair, or just even if you just twist your ankle, that could lead to fracture. Okay, because of your own weight, the bones can fracture. These are the side effects of osteomalacia. So before going to the risk factors, India being a tropical country. Tropical country means what? The geographical position of India. We from Kashmir to Kanyakumari, everywhere, each and every state of India, okay, majority of them, they have ample of sunlight. Okay, in India, we are not lacking exposure to sun. Okay, we have enough and more of sun exposure because it's a tropical and subtropical country. Okay, we are not that far away from the equator, but still, after having such a geographical positioning, as still, okay, Indian population, 60% of Indian population are found deficient in vitamin D. Could you understand what would be the reason? Even though we have such good sun exposure, why Indians are still deficient in vitamin D? And India is a young country. Okay, India is a young country. Majority of our population is between the age group of 18 to 39. Once you start aging, naturally your vitamin D levels will fall. Okay, you will become deficient in vitamin D and calcium. But being a young country and being a tropical country, still Indians are suffering from vitamin D deficiency. Yeah, we have a low dietary intake, okay, of vitamin D. On top of that, there is the issue of colorism. Okay, colorism means you will not go out in the sun, and you will discourage your kids also to go out in the sun, because what if they get tanned, they get dark. Okay, in India, we have this innate likingness towards a fairer skin. Okay, and the first step towards a fairer skin in majority of the household is don't go out in the sun. Okay, it is more strict towards females as compared to males. Don't go out in the sun. Okay, you will discourage your even kids to play out in the sun. Okay, if you want to play, play in the evening time when there is no sunlight, so you will not get dark. Okay, so the issue of colorism is also there. That's a social issue of colorism. And definitely intake in diet is very less. Okay, so majority of Indians, even though with diet you may have vitamin D, but the synthesis of vitamin D within your body is too low. Okay, Indians are not getting enough sun exposure. Okay, until and unless you are forced to do some laborious work. Okay, in such cases synthesis will be adequate, but otherwise in all the other middle class family or upper middle class family, people are discouraged to go out in the sun because of colorism issues. Okay, and 90% of the vitamin D you get because of the synthesis of vitamin D that happens, not from the diet. Coming to the risk factors, inadequate exposure to sunlight, as I mentioned earlier, not going out, unrefined cereals, having unrefined cereals like multigrain or full husk cereals are there in the diet. You're not refining it properly because unrefined cereals have the fiber and some phytates that are present in unrefined cereals that will not allow the absorption of vitamin D from the food. Then vegetarianism, vitamin D deficiency is very common in vegetarians and vegans. Okay, the diet is naturally very low in vitamin D. Prolonged breastfeeding in women. Okay, when you breastfeed for a long period of time, some women breastfeed their children up to the age of 4 or 5 years old. So that will cause harm in the mother's health. Okay, mother's vitamin D sources will be depleted, calcium sources will be depleted to produce the breast milk. Okay, so prolonged breastfeeding will also lead to deficiency. Skin pigmentation. Naturally, Indian skin, the brown skin, or even darker shades of Indian skin, we naturally have an SPF of around 4 to 5. Okay, sun protection factor. People who are of a very fair skin tone, like Caucasians, the ethnicity of Caucasians, white people, or generally fairer people, their skin will absorb more sunlight as compared to darker skin toned people. Okay, darker skin will absorb less sunlight. Okay, and on top of that, people who are already under the brown skin, wheatish complexion, or dark skin, they will purposefully avoid going out in the sun, for they are scared they will get more darker or deeper in skin tone. Okay, so there is absolutely no skin synthesis of vitamin D. Okay, so skin pigmentation also plays a part in vitamin D synthesis. Then age. With age, vitamin D synthesis goes down, and also vitamin D absorption from the skin, it goes down. Then about osteomalacia, what happens in osteomalacia? Demineralization is happening. About SPF, I'll explain you later. That slide is coming up. Okay. So osteomalacia, softening and weakening of bones is what we call as osteomalacia. Why the softening has taken place? Because the major minerals that gives density to your bones, that has been used up by the body. Okay, because of the deficiency of it in diet, body will scavenge its own bones to fulfill the requirements of these minerals in blood or other major parts. Okay, so imbalance of minerals like calcium, phosphorus leads to the deficiency or deficiency or decreased ability of bones to harden. Okay, and that will give you pseudo fractures. Pseudo fractures means because of your own body's weight and the bones are soft, weak. Okay, bones are unable to have carry your own weight, and cracks will happen here and there. Okay, causes: vitamin D deficiency, calcium deficiency, lack of sun exposure, diet that is low in vitamin D. Okay, and sometimes some medications. Okay, or some medication or some health condition will also not allow the absorption of vitamin D. For example, malnutrition, chronic diarrhea. Okay, in these kind of conditions, or some chemotherapy drugs. Okay, chemotherapy agents, chemotherapy drugs can also cause malabsorption in your intestine. You're not allowing your intestine to absorb vitamin D. Diagnosis: you have to take the medical history, do physical examination, do DEXA scan. Okay, dual energy X-ray absorptiometry, DEXA scan. You will identify your bone density. The bone biopsy can be done, X-ray can be taken. Okay, imaging, X-ray can be done, CT scan can be done, blood test can be done to identify the serum vitamin D3 levels. Okay, kidney failure can also cause vitamin D deficiency, because then the kidneys will not be able to produce 1,2-dihydroxy cholecalciferol. Okay, that cannot be produced by the kidneys. Okay, DEXA scan, dual energy X-ray absorptiometry, that is bone density scan. Okay, treatment: you have to do dietary changes. Okay, take fortified vitamin D fortified food, or supplementation will be prescribed to you by your physician. If you are undergoing kidney failure, medication to balance your mineral and hormone levels will be given. Okay. If you're a kidney patient, or if you are undergoing kidney failure, directly 1,2-dihydroxycholecalciferol hormone will be injected in your body. Okay, to balance out the hormone. These are the treatments options available for osteomalacia. Here you can see what actually happens in rickets or osteomalacia. This is the normal bone. Normal bone has normal trabeculae and normal bone mass. Okay. Trabeculae, understand it as a matrix. Okay. Bone trabeculae, understand it as a matrix. So these trabeculae are very thin columns that are present in the bone, inside the bones, spongy structure. And through the trabeculae, a lot of blood vessels can also travel. Okay. And what happens in osteoporosis? Trabeculae becomes very thin and scattered. You can see here the black network which is there, trabeculae. Okay, that becomes very thin and scattered. Okay, there is no connectivity. You can see here, these are just pieces of trabeculae here and there. They are not connected to each other. Okay, poor connectivity and low bone mass is also present. Okay, this happens in osteoporosis. So it becomes porous. Okay, big holes will be present instead of trabeculae. Big holes will be present. Okay, holes are pores. Okay, so that's why osteoporosis. Here in osteomalacia, trabeculae is not affected. Okay, but there is no calcium or mineral within this bone mass. And osteoid is immature bone. Immature bone will be found around the trabeculae. How can this osteoid become matured? Only when there is a deposition of calcium and mineral. When there is no deposition of calcium and mineral, the osteoid will stay osteoid. Immature bone cells will stay immature because there is no mineralization taking place. Okay, so this is the difference between osteomalacia and osteoporosis. Is it clear to all? So this is based on your skin tone without sunscreen. Without sunscreen, this is the time period you have to be out in the sun. Without sunscreen, this is the time period you have to be out in the sun so that adequate amount of vitamin D synthesis will take place. Okay. So those who are fair skinned, okay, very fair skinned, like if you suffer from some conditions like vitiligo, okay, or you come from a very fair ethnicity, Caucasians or white people in general. Okay, if they spend just 10 minutes, 20 minutes, or even 30 minutes in different seasons, seasonally it has been uh, separated. Okay, summers just 10 minutes spring or autumn, that is the months of September, October, November. Okay, 20 minutes out in the sun. Winters just 30 minutes out in the sun. That is more than enough. Okay, that this is the recommended amount of sun exposure for fair people, very fair people. Indians come in this range, medium skin to dark skinned. Okay, we have a range of skin color that you find in India. Okay, so if you are in the wheatish category, okay, fair to medium to wheatish category, based on your skin tone, in summers at least 50 minutes you have to be out. Springtime or autumn time at least more than 2 hours. Winters more than 3 hours you have to be out. Okay, dark skinned people, you have to spend most of the time out, so that enough amount of sun exposure and vitamin D synthesis takes place in your body. Okay, so you can see the timings given here based on minutes. So darkest skinned people need 10 times more sun exposure than fair skinned people. Okay, because since dark skin absorbs few UV rays, because the melanin that is present on your skin. Okay, the more melanin you have on your skin, more will be the natural SPF that you have, sun protection factor. Okay, and whoever is the darkest of darkest person will not have more than 5 or 6 SPF. Okay, the main SPF, the major SPF that your skin has. Okay, the most SPF that a human skin has, even if they are the darkest of a person. Okay, it will not be more than 6 or 7. Okay, Indian skin tone naturally has an SPF. It is a brown to medium skin tone, will naturally have an SPF of around 5, not more than that. Okay, based on what you're exposing, is it face, arms, legs, or back, sunscreen should not be applied, because sunscreen will not allow the UV rays to actually cause the photo conversion in your body. Okay, and you must be outside, because UVB rays, UVA can penetrate through the glass, but UVB cannot penetrate through the glass. Okay, so sunlight majorly has 3 types of rays: UVA, UVB, and infrared. Infrared rays we can't see with our naked eye at all. Okay, UVA and UVB, under specific lightings you can see that. So UVA rays will cause aging in your skin. If you expose yourself more than enough on the skin, out in the sun, okay, it can accelerate aging. You will look more older, because UVA will cause more aging. UVB can burn your skin. Okay, UVB, B for burn, UVA, A for aging. Okay, so glass, when you are inside a room, or you have closed your windows have glass. Okay, UVB, the rays that cannot burn you, that cannot enter, but the UVA that can still age you, that can still enter, that can still penetrate through the glass and cause you harm. Okay, so to get enough amount of sun, a healthy exposure of sun, you have to be outside, not inside. Okay, and do not apply sunscreen when you are out. For example, if you're going out for a brisk walk early in the morning or late in the evening, don't apply sunscreen, and complete this work within 1 hour, because Indians usually we come in this category, medium skin to dark skin. Okay, you can afford to be out in the sun for 1 or 2 hours. Okay, before 9 a.m. Before 9 a.m. you can afford to be out in the sun for 1 or 2 hours. You will get your healthy amount of sun exposure as well. Okay, is it clear to all? Yes, more melanin means less absorption of sunrise. Coming to the sources of vitamin D. Read all the non-vegetarian foods, okay? Egg yolks, oily fish like sardines, mackerels, tuna, beef liver, salmon, mackerels, tofu that is fortified, milk that is fortified with vitamin D, yogurt again fortified with vitamin D. Avocado and broccoli has very less amount of vitamin D too, but not enough to fulfill the requirements of human beings. Okay, they have a bit of vitamin D2, plant-based vitamin D2, which first of all will not be absorbed. And if you require them to absorb them, you have to have kilos and kilos of broccoli or avocado, which is humanly not possible to have in one meal. Okay. Early morning is the best time for sun exposure. Cereals and products that can be fortified. Okay. These cereals and products, they don't come naturally, they don't have vitamin D, but they can come fortified with vitamin D. Okay, check the packaging. Soy products can come fortified with vitamin D. Milk, cheeses are fortified with vitamin D, they can be fortified. Even refined oils. Okay, all the cereal attas that you get, multigrain atta or any Ashirwad atta, whatever atta that you use, they can also be fortified with vitamin D. Mushrooms, if you are using mushrooms, wash the mushrooms properly. Keep the mushrooms out in the sunlight for 10 minutes and then use it in cooking. They become a really good source of vitamin. Am I audible? Is my screen visible? Okay. So mushrooms, when you're using mushrooms, any form of mushrooms, wash it properly, keep it out in sunlight for 10 minutes, and then use the mushrooms. Okay, it becomes a really good source of vitamin D because mushrooms basically are fungi and they can also synthesize vitamin D. Mushrooms are capable of synthesizing vitamin D. Okay, so mushrooms that have been exposed to sunlight, just like human beings, mushrooms, when exposed to sunlight, they can synthesize vitamin D. Okay, and they become a good source of vitamin D. Oatmeal can also be fortified with vitamin D. Butters, okay, white mushrooms, button mushrooms. Coming to the RDA of vitamin D, birth to 1 year of age, you don't require much because whatever vitamin D is required, it comes from the mother's breast milk. Children, at least 15 microgram. Having milk 2 times a day is sufficient. Teenagers also around the same, having milk 2 times a day is sufficient. Adults also. People who are 71 years or older, it increases. They will have to take supplements. Okay. Senior citizens, they have to take supplements. Pregnant and breastfeeding women, again, 2 glasses of milk a day, it is sufficient. Okay. So vitamin D toxicity, when you overdose yourself with vitamin D, it could lead to hypervitaminosis D, okay, or vitamin D toxicity. Some symptoms, dizziness, appetite loss, increased thirst, frequent headaches, tiredness, nausea. It does not happen overnight. Vitamin D toxicity can only happen when you are regularly abusing vitamin D supplements, okay, over a period of time. That's when vitamin D toxicity happens. Hypercalcemia can also cause vitamin D toxicity. The maximum tolerable upper limit a human body has is 10,000 international unit of vitamin D on a daily basis, not more than that. So coming to the next part of the session, vitamin E, and vitamin K, assignment you have to do. okay, about vitamin E and K. You can write down the assignment in paper, take photos of it, send it to me, WhatsApp me, and also mail it to this email ID, assignment@nhca.in. Okay. Maximum vitamin D a person can take is 10,000 international unit per day, not more than that. Okay. Okay. So coming to the assignment, function of vitamin E, function of vitamin K, RDA of vitamin E, RDA of vitamin K. Okay. Use the textbook or use Google as well to find it out, and use the latest detail of ICMR. Okay. Sources, best sources of vitamin E, best sources of vitamin K. Deficiency of vitamin E, vitamin K. Treatment, how do you treat the vitamin E and K deficiency? Dietary treatment. Okay. Don't use supplementation microgram mg here. Specifically, it should be dietary treatment. What dietary changes you will suggest to a client to improve their vitamin E and vitamin K status? Okay. There is a correction. It is a dietary treatment only, no other treatment. This is your assignment. By next week, by next Monday, you can submit it. Please take a screenshot of it. Send it to this email as well as, okay, send it to me as well, WhatsApp me as well. Okay. Is it clear to all? I have mentioned my WhatsApp number in the chat box, those who do not have my WhatsApp number. Assignment can be handwritten, take a pic of it and send it, or you can make a file of it. Okay, Microsoft file in Word format. You can send it to, mail me as well. Excel form is also fine. Okay. Function of these two vitamins, RD of these two vitamins, sources of vitamin E and vitamin K, deficiency and treatment, dietary treatment. That's it. It would be 1 or 2 page assignments, point wise point. Don't make paragraph wise, make it into point wise. It will be easier for you to learn as well. If you have any queries, you can